I work within southeast Queensland where we have a lot of trouble with skin cancer. It's even within Australia, it's one of the highest sort of incidences of melanoma within the world. So for most sort of white Australian people in this area with skin like mine, popping in once every 12 months is a good idea. And that regular skin check is about trying to find problems when they're really small now and trying to avoid larger problems down the track. So if we find a skin cancer when it's quite small, it's on your arm or wherever, and it's a couple of millimeters large, then we will pop down, take it out and put 2 sutures in it that day or the next day, and the story's all over. But if we don't find that until it's larger, the size of a 10-cent piece or a 20-cent piece, and then we can start to talk about what type of reconstructive surgery is needed or what referral is needed. And if we're talking about the nasty sides of skin cancer and melanoma, we have to start talking about whether it can actually threaten your life as well. So if we can take those big problems from 5 years down the track and pick them up when they're tiny today, then it saves everyone a lot of trouble in the long run. If the only time you see your doctor about your skin is when you have a problem, you're missing out on a very large part of what we do when diagnosing skin cancers. So within a clinic like I work at, roughly 80 to 90% of the confirmed skin cancers that we find are things that the patient wasn't aware of or was aware of but wasn't aware that they were a problem. So we have enough technology nowadays where the previous way of doing things, where a patient would come in when a spot was bleeding or come in when a spot was itching, is not really how a normal skin cancer is diagnosed these days. It is most common for us to diagnose a skin cancer by finding a spot that has no symptoms, finding a spot that the patient isn't aware is there, and telling them on the spot that this looks suspicious and we can take it out. And that's beneficial in the long run. So if we're finding things before the patient's aware of them, we're finding them before they're large, before they're bleeding, before they're complicated, and before they're potentially life-threatening as well. So getting in and getting your skin checked regularly means that we have the ability to do that. Obviously, if you have a spot on your skin that is bleeding and concerning and you're worried about it, that's a great time to pop in to see us. But by doing a full skin check as a part of that, we'll often find that same problem that you've got now, we'll find it 2, 3, 4 years earlier when it's a really tiny thing and easy to deal with. As part of your skin check, what's standard at our clinic is skin checks are usually performed with the underwear all completely on. But as a skin cancer doctor, I'm happy to examine whichever areas and whatever areas you're happy for us to have a look at. So if you want to come in and just want to have a skin check of the areas on your face, because we do find a lot of trouble there, then absolutely we can do that. If you want us to check the areas on your arms where you get sun exposed, then absolutely we can do that. As I was saying earlier, the more of your skin we can see, the higher chance we've got of finding any problems. But obviously, if you feel more comfortable with another family member in the room or with a chaperone in there with you, we're happy to sort of provide that for you. But the more skin that we can see, the better chance we've got of finding something abnormal. But if you only feel comfortable showing us certain areas, sun-exposed sites perhaps, then we're more than happy to give an opinion just on those as well.